I now have the pleasure of introducing our alumni speaker, Lindsay Gressard, graduated in 2012 from the MPH program with a specialty track in prevention sciences. Her thesis, chaired by Dr. Monica Swan, was titled, "Does the Gender Inequality Index Explain the Variation in State Prevalence Rates of Physical Teen Dating Violence Victimization?" And it was recently published in the American Journal of Preventive Medicine. She completed her practicum in the Division of Violence Prevention at the Centers for Disease Control and Prevention. She was also a recipient of the Georgia Health Foundation Scholarship while she was a student in the MPH program. Today, Lindsay is a program evaluator in the Division of Cancer Prevention and Control at the CDC. She recently completed the Presidential Management Fellowship, a government-wide training program for emerging leaders in federal agencies. During her fellowship, she completed a 6-month rotation in the U.S. House of Representatives with the Committee on Natural Resources, where she worked to bring a public health perspective to environmental and conservation issues. Please welcome her to the podium.
Good morning, everyone, and congratulations to all the esteemed graduates. This is an awesome and important accomplishment. Now, I know when you were in the throes of your thesis or capstone or dissertation and you were wanting to throw your laptop off the 8th floor window of the Urban Life building, it was probably hard to remember this. But a graduate degree is an honor and an accomplishment owned by very few people, and now you are one of them. I know your family, friends, and professors are all extremely proud of you. Now, before I go further, I just feel like I need to admit something. When I was asked to come here to speak to you all today, I kind of felt like I was maybe being punked. It's because I don't feel like I would necessarily be the person I would have imagined to give career advice to anyone. I think I would have imagined someone who knew that they wanted to do public health since day one. I don't think I would have imagined someone like me who changed her major 5 times in college, including art. That was my advisor's favorite. And I certainly didn't think it would be somebody who used to jump from job to job every other year, ranging anywhere from being an 8th grade counselor to working in a DNA paternity testing lab. I really did that. It was just like the Maury Povich show, except not as fun as putting it on TV. But then it dawned on me. My roundabout path to public health, I don't think it's that unusual. In fact, if I were to guess, I would imagine that many of you came from different backgrounds before you came to public health. And those backgrounds could range from anywhere from education to law to nursing to paternity testing. And frankly, I think all these different perspectives is what makes public health such an amazing field to work in. Every day of my job at the CDC, I get to benefit from the skills of people who carry expertise from so many different fields. And it truly enriches our work and makes it stronger. So no matter how different your background may have been before you came to public health, don't be afraid to showcase that and use it as an asset. Believe it or not, when I got to work on the Ebola response and create data presentations, I actually got to use that art major. I also want you to know that you've chosen one of the most important and most interesting jobs on earth, and I can say that because I've had so many jobs. Public health touches so much of what you see in the news right now, even when it seems unrelated at first glance. Just as an example, as Dr. Len mentioned, this past year, as part of my fellowship, I did a rotation with Congress in the House Committee on Natural Resources. And I was a little worried at first that natural resources didn't really scream public health. I was worried that it wasn't going to have a whole lot to do with my training. But it didn't take long before I realized that the committee really needed someone who could tackle environmental issues like climate change and biodiversity from a human health perspective. And that's because really, no matter what the issue is, people always want to know, does this affect my well-being? And if it does, how can we prevent it? So don't be afraid to explore the vast world of public health and a little beyond. With your training, the opportunities are truly infinite, all the way from the federal government and international NGOs to a local health department or school. And now more than ever, we need a strong public health workforce in every corner of the world. So for those of you who will be staying in Atlanta, please stay in touch with Georgia State and the School of Public Health. Please sign up for the Alumni listserv, join the Alumni Facebook page, and join us at EHANS for happy hours or other social events. The Alumni Network really can be one of your greatest resources, whether you're looking for a job or you're already in a job and you just need help with something. And of course, next fall, on the Saturdays, please come out to the Georgia State football games and watch the Panthers beat Georgia Southern once again for the third time in a row. It's not bragging if it's true. And for those of you who will be leaving Atlanta, please don't be afraid to show your Panther pride to the rest of the world. When I was in DC this past year, I'm a little disappointed to say that I met a few people who weren't quite familiar with Georgia State yet. But don't worry, I quickly reminded them, and I hope you will too, that this is the Georgia State that was ranked the 4th most innovative university in the nation. And this is the Georgia State that the New York Times and the Gates Foundation featured for being able to graduate first-generation and low-income students at the same rates as others. And this is the Georgia State that believes in a beautifully diverse student body, believes in its accomplished faculty and staff, and most of all, believes in its school public health graduates to get out there and make the world a healthier, happier place. Thank you so much for having me, and congratulations.